Hello, everybody. I'd like to welcome you today on behalf of Stratus Health, the Minnesota organization that is part of the Lake Superior Quality Innovation Network, or Lake Superior QUIN. The Lake Superior QUIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Program. Our educational session today is Integrative Approaches for Wellness in Post-Acute Settings. This webinar is a result of one of the Minnesota West Metro Coordination of Care Community Coalition Workgroup efforts, and I'm pleased to be presenting with leaders in Minnesota who have been working on improving care for persons in the post-acute setting. I'm Janelle Shear, and I'm a program manager here at Stratus Health. I lead the Coordination of Care Initiative, and I'll start the presentation with a little bit of background, and then next our speakers will share about the work and the tools that their workgroup has done. So many of you have been participating in the Coordination of Care Initiative in your states, and basically what it is, it's a community-based approach to improving care transitions and care coordination as people move across the healthcare continuum. Our ultimate goal is that people are at home more and that we are able to reduce admissions and avoidable 30-day readmissions. So this is a map of the Minnesota communities. In Minnesota, we have 10 communities. The community circled is the West Metro, which is where this work group comes out of. But altogether, in our 10 communities, we are reaching about 83% of our Medicare fee-for-service beneficiaries in our states. And all of these communities have been working on community-level efforts to improve care for the people that they serve. So our objectives today are we will talk about the role anxiety plays in post-acute settings. We want to have an understanding of how integrative therapy techniques can be used to mitigate anxiety with ultimate goal of reducing unnecessary hospital readmissions, and then to learn about an Anxiety Shared Pathway Toolkit that you can use across the continuum of care to help with patients, clients, and residents. Before we start, we have a couple of polling questions we'd like you to ask. The first one is, have you cared for residents, clients impacted by anxiety? Yes or no? About a few seconds left. I don't think the answer is going to be too surprising on this one. Okay, Jenna is monitoring our survey and chat, and I'll have you just explain the results.
Looks like majority of yes.
Okay, great. We had nobody that said no. So I think anxiety is something pretty common that we experience or our clients and residents do. Okay, the second polling question, we're wondering, have you used integrative therapies such as aromatherapy, healing touch, massage, etc. in your own lives? And that would be a yes or a no. Okay, and Jenna, what do we have for this one?
Looks like, again, another majority of yes, but one no.
Okay, so that's great that people are familiar with different integrative therapies. Thank you. Thank you for responding, everybody. So now we'll get into the program part of our webinar today, and I'd like to introduce our speakers. I'll do them in the alphabetical order that they are on the screen, but actually Nicole is going to be starting, and it'll be kind of some back and forth between the three speakers. Nicole Matson is a nursing home administrator with experience in human resource management and finance. She has an MA in Human Resource Management from St. Mary's University. She's a health services executive, qualified, and working for Good Samaritan Society Specialty Care Community, which is a 96-bed specialty care facility that also has a thriving post-acute unit. Nicole has opportunity to embrace all the diversity that skilled nursing services and settings have to offer. Second is Kendra. Kendra Wiley is a registered dietitian, has practicing in clinical nutrition for 10 years. Additionally, she holds a master's degree in holistic health science studies and has implemented integrative therapy programs in a variety of healthcare and community settings. She holds community classes on integrative therapies and holistic nutrition, teaches yoga to populations with unique needs, and instructs nutrition courses at Normandale Community College. She has served as Good Samaritan Society Specialty Care Community's Wellness Resource Coordinator since December of 2015. Her desire is to make integrative therapies accessible and practical for everyone. And then Peg Lucian, and I see I didn't do what I said, but this is the order that they'll be speaking. Peg has worked in the healthcare industry for the past 20 years or 30 years. She has held a variety of analytical and operation positions in the area of planning, marketing, and revenue management. She's currently the Vice President for Fairview Partners, a program that oversees the Skilled Nursing and Transitional Care Network for Fairview, as well as provides care coordination for dual-eligible enrollees in their own homes and in partner senior living communities. Peg holds a master's degree in healthcare administration and a bachelor's degree in marketing and management. So before we start the program, I'll mention that we're offering certifications, certificates of participation that can be used for continuing education credits. After the presentation and before you log out, a short evaluation survey will pop up. So please complete that, and then once you've completed it, you'll receive a certificate of completion to print off. And if you have others with you that want a certificate, you will need to make copies for them as well. Okay, so now let's start our presentation.
So I'm Nicole Matson from Good Samaritan Society Specialty Care, and as Janelle mentioned, our work group in the West Metro formed an initiative to look at hospital readmissions. So the Shared Pathway Work Group really consisted of a variety of different people. There was good diversity and representation there from throughout the care continuum. We had people from home care, people from Stratus. We even had somebody from a DME company, but there was lots of diversity of perspective. And then as we kind of got further down the line, we decided that we needed to add in some additional expertise with integrative therapy, people that were familiar with various modalities and treatment options. So our work group determined that rather than focusing on one particular pathway or a set of a variety of different pathways, that we would focus on anxiety. The reason being that anxiety really underpins many different hospital readmissions and crosses many different diagnoses. Anxiety is something that can be easily treated within our care settings, and also we had some familiarity with it at my facility, Good Samaritan Society Specialty Care, and that we had put together a program that included tools, modalities, and protocols. And just a little bit about our facility. It's a 96-bed facility in Robbinsdale, 64 are long-term care men and people with Huntington's disease, and then it's a 32-bed post-acute unit. And as Janelle mentioned, Kendra is our Wellness Resource Coordinator, and she has directed our wellness program since 2015. She's trained all of our staff on integrative therapies such as aromatherapy, hand massage, healing touch, and some in Reiki, and she's really directing the wellness program for our facility. So the whole intent of the pathway was that it could be used in a variety of different care settings to offer techniques to mitigate anxiety. It could be even have self-care applications, but that it would be easily accessible and useful in a post-acute setting, a home care setting, and again, maybe even by a family caregiver. There's research and data, and we had some DMP student involvement that the presenters will go into as well, but really that integrative therapies can help people feel increased satisfaction with their own health outcomes, puts them more in the driver's seat. They have an increased overall sense of well-being, and that was one of the drivers that led us to use this toolkit. So I will turn it over to Kendra to talk more about anxiety in post-acute settings.
So as you all know, based on your poll earlier, that anxiety symptoms can and do affect many individuals in our post-acute settings. Common diagnosis with anxiety components include CHF and COPD, and really any of those diagnoses that have to do with breathing tend to have more anxiety. But we also know that there are many other health conditions that can stir up these symptoms of anxiety. And other factors which can contribute to anxiety symptoms that we see from individuals, people that may have underlying depression that hasn't been addressed by their provider. Research shows that anxiety very commonly is paired with depression, especially untreated depression. Again, also underlying or untreated generalized anxiety. We see this often for people who are in an acute setting and being treated for some other disease or comorbidity, but have symptoms of underlying generalized anxiety that isn't necessarily being addressed. Health anxiety is another type of anxiety that we see in post-acute settings. Particularly, this is surrounding anxiety around one's health and their treatment or lack of treatment. There's a lot of components within health anxiety. And then the one that I see most often, and I'm sure you probably do too, is that situational anxiety. So maybe they don't have anxiety symptoms when they're at home or before the health event, but now something has happened. So they are in perhaps a place of transition, meaning maybe they have to change where their living situation, or they now have home care and have to allow people into their home. They have potentially loss of abilities or lifestyle. They are unable to do things that they once were able to do. I also see a lot of anxiety around finances and how the bills are going to get paid, how they're going to pay for their housing or pay for their care. Again, housing, where they're going next, is their house safe? Do they need somewhere else to go? And then a bunch of other social determinants of health, where people are getting their next meal from, who is caring for them, are their medications paid for, the list goes on. And so when I see anxiety in people in a TCU post-acute setting, a lot of times it's related to their situational anxiety. There's been a huge change in their life, and that is stirring up these anxiety symptoms. And we know that anxiety can negatively affect outcomes in post-acute clientele. There's research to show that we see an increased rehospitalization rate in populations that exhibit anxiety symptoms or have an anxiety diagnosis. Anxiety also hinders the ability for individuals to participate in therapies, OT, PT, speech. So maybe they're too anxious to leave their room, or too anxious or scared to stand up or transfer, or any of those sort of things that are definitely roadblocks or barriers to improving their functional ability and ADLs. We also see that anxiety can negatively affect outcomes when there is that lack of engagement within their own personal health. So the anxiety has taken over to the point where there's some disengagement with the plan that happens next, or perhaps the focus is on anxiety beyond, where they're going or what happens in their health going forward. And that can be difficult to work with when you have people who are disengaged with their own health and their own health care going forward. Conversely, on the opposite end is that hypervigilance in their personal health care. So these individuals we see are hyper-focused on their care and their treatment, and this can be great, but sometimes that can create a barrier when maybe their anxiety or that hypervigilance control is perhaps not reality-based, and so that can create barriers to safe progression and transition going forward. So at Good Samaritan Society Specialty Care, we worked with to sort of develop a pathway over a couple of years. We worked with a mental health psych, doctor of nursing practice student to specifically address anxiety in our post-acute TCU setting. And we started off this process by completing a literature review regarding anxiety and this population and the best way to mitigate or treat anxiety with these individuals. And so through the literature review, the student and I, Michelle Anderson, we developed a pathway to help mitigate these symptoms of anxiety, specifically to reduce rehospitalizations. So from the literature, we chose a screening tool to be used on all transitional care unit residents upon admission called the Short Health Anxiety Inventory, or the SHI tool. And depending on the score that the individual got on the SHI, there was corresponding interventions were implemented. And the SHI tool is specific to health anxiety. So there are it's an 18-question tool, and it asks specifically about different components of health anxiety, noticing bodily sensations, etc. Research shows that it is obviously effective for indicating health anxiety in an individual, but the research also shows that it should be sensitive enough to pick up on generalized anxiety as well. So based on the pathway interventions, if someone fell into the low-level anxiety symptoms, they had their care plan built up for aromatherapy, deep breathing, hand massage, and acupressure. The aromatherapy was specific to using citrus oils or lavender essential oil. There's a lot of research around those two oils, particularly with anxiety. So those are the ones that were put in first, but then obviously resident choice came into effect. So if the resident didn't want citrus or lavender, they were offered something else, but those were the two that they were offered first. Deep breathing, again, was another one that was put into the care plan. So a TMA, CNA, nurse, whomever, could lead an individual through a deep breathing exercise. And then hand massage was put in there as well as 1 or 2 acupressure points that the staff were trained in to offer if the individual was exhibiting anxiety symptoms. And we asked every the people caring for the resident per shift, so 3 times a day, they were asked to monitor them for anxiety symptoms, and if they were exhibiting anxiety symptoms, then they would offer options for the modality. And when the individual tested into the mid-level symptoms, they got all of the above that I spoke about, but they also got a visit from the wellness coordinator, which is me, and so they would get an individualized personal meeting to work through some maybe more individualized modalities and things that would work for them, as well as a chaplaincy visit as appropriate. I would make referrals out because some of these people just needed really someone to talk to, and so having more hands on deck was helpful there. And then for the last level, the high level of symptoms, they got all of the above, plus an invitation to a weekly anxiety group. and also a referral to our house psychologist who comes to our facility weekly. So we did a lot of research about how to develop basically a psychoeducation group for anxiety or health anxiety. So we included sharing, validation, art process, cognitive behavioral therapy components. We started each group with a pre-survey for anxiety or health anxiety using the smiley face chart. And so the individuals in the group or participants would indicate at the beginning of the session where their anxiety was at using the smiley face chart. And then we would do a check-in. And the check-in's objective really was to create community and place value on each individual and their unique experience. So using some validation techniques, we'd allow participants to, we call it, put a word into the circle. So people are open to sharing, and even people who aren't super open to sharing, they can say one word into the group. So it allows individuals then to engage with their emotions, perhaps physical sensations or spirituality in the moment. And we allowed the participants to choose one word or a few words to share with the group on how they were feeling today in this moment. We did some mindfulness work as well, so that encourages the participants to focus on the present moment, remain open to their experience, come from a place of non-judgment and acceptance of things as they are, connection, peace and tranquility and compassion for themselves and for others. And so we did a handful of meditations, rotating through each week, so we didn't do them all at once. And then we did those cognitive behavioral therapy principles, so encouraging group participation, normalizing health anxiety, identifying some of those avoidance strategies, and then helping to develop new coping strategies. So we talk about triggers of anxiety. We talk about the avoidance strategies, and so putting a name to that's really powerful. And then we would brainstorm new ideas for new strategies that are more helpful. So we did some art processing, making personal mantra cards or words that they could repeat to themselves and put in their room as a visual reminder. And then with the group, depending on the size of the group and the cognitive ability of the group, we would discuss personal goals for health. So sort of moving forward and what they want to work on and what their desires are. And then we would do a post-survey at the end using that smiley face scale to sort of show how they felt before the group started and how they felt after. So then it wouldn't be fair unless I talked about some pathway barriers, be a little realistic here. But some of the residents were reluctant to come to the group for a myriad of reasons. I heard them all, and a lot of it was they were tired because they're doing therapies during the day, so I switched around what day and time we would do the group, or they wanted to be alone, or maybe their anxiety was too much so they didn't want to leave their room, and so it was hard to get people to participate in the group, but we did get a few people over several weeks to come, so that was good. But that was definitely a large effort on my part, was to get people to come to the group. Once they got there, everything was fine, pretty much. But getting people to come was the difficult aspect. And then another barrier was that SHI tool did not seem to capture all of the anxiety symptoms. People would answer the questions and not identify themselves with health anxiety specifically, and it really didn't seem like it was picking up on that generalized anxiety or any situational anxiety. It seemed much more sensitive, obviously, to the health anxiety, but it wasn't sensitive enough in our experience to pick up on those other anxiety symptoms. And so I would see people while I was doing the SHI tool with them, exhibiting lots of anxiety symptoms, shifting their weight, asking lots of questions, wringing their hands, but saying no, no, no to all the health anxiety questions. Also, the health anxiety inventory tool is 18 questions long, and it's wordy. So it's a lot of words to get out, if the individual you're working with has a hard time reading or seeing, you have to read it out loud, and then you have that auditory processing, and so when there's lots of words and lots of choices, it can be a little confusing, and so that was another barrier, and it took a long time to implement with each individual, so it wasn't extremely efficient. So halfway through maybe even a little bit more than halfway through implementing the pathway, we trialed the GAD-7, so that's the Generalized Anxiety Disorder Screening Tool that has 7 questions, and that was giving us much better results. People seemed to be testing into the areas that, based on observation, looked like it was maybe a better fit for them, and so it was much quicker too, and people were more likely to complete the screening tool because of its how short it was. And I will now pass it on to Peg, who will talk about the toolkit in specific.
Yeah, so as mentioned, the variety of organizations comprised our work group, so we were able to utilize people's expertise to contribute to the various sections in the toolkit. And I work for Fairview Partners, which is a program that contracts for the Post-Acute network for Fairview. And so I was able to connect with integrative therapy experts from the Fairview system to be able to be a part of the work group as well. And so what we decided finally was the work group, we determined that an internet-based toolkit would be the best approach to educate and prepare the staff to implement their own programs. And we obtained permission from Stratus Health to house the toolkit on their website. And so this is what it looks like when you reach the website and the link, and we'll provide the link later on in this webinar. And so we have the toolkit content, and it has, these are all the sections that the variety of people that were on our work group were able to contribute to. So it starts out with the background and the intent of the toolkit. And these are just screenshots. It's not the actual website that we're in right now. We just took a small section of each of the sections of the toolkit. So this is the background. And this is the assessment tool that Kendra contributed to the toolkit. And so I'm going to turn it back over to Kendra to talk a little bit more about the GAD-7. And in the toolkit, there's an actual link to this assessment tool for you to use.
So the GAD-7 tool, I am a fan of using for this pathway in particular. It is 7 short questions that have, they can answer, the question number 1, are you feeling nervous, anxious, or on edge? And then they can write it, not at all, several days, over half a day, or nearly every day. And so there's only 4 options of that sort of Likert type scale that they can choose. And so if someone can read it, they can complete it themselves, or it can be read to an individual. There's many less words in this, but it makes it helpful. Also, the GAD-7 tool has been tested as being sensitive for identifying probable cases of generalized anxiety disorder. It also has been shown to be sensitive for picking up on health anxiety, situational anxiety, and PTSD as well. And I also like the GAD-7 tool because it is available for anyone to reproduce or translate, display, or distribute, so you don't have to pay for those rights, and it's available to everyone, so it's super accessible. And then for us on the what we developed as far as cutoff points, so this isn't about the GAD-7 specifically, but for using our pathway that we created, if someone scored between a 5 and a 9, that was considered mild, so that would be that low level. If the individual scored between a 10 and a 14, that would be considered moderate, so they would fall into that second level of intervention. And then if they had greater than 15 for their score, it would be considered severe, and they'd fall into that high level of intervention for anxiety. And the range for the test itself is 0 to 21, just for your information.
And the next section is the funding ideas, and Nicole contributed to this section because she has experience working with these various funding ideas. So Nicole, do you want to talk a little bit about those?
Sure. So we originally funded our wellness program and Kendra's position specifically with a PIP grant, which is through DHS. It's a performance-based incentive payment program. It's specific to nursing homes, and I do get that, but it's a good opportunity. They are looking for to support work that is innovative, that looks at particular quality, any of your quality indicators, and can try to move those quality indicators. So we had success with that, and then obviously we've been able to sustain her position subsequent to the original funding year. Another opportunity is just foundation grants. There are many foundation grants that are out there that are looking to support innovation in healthcare delivery. The Minnesota Council of Nonprofits is a great resource. They also have information on how to write, for grant writing. If you don't have somebody that does that, you don't need to be an expert. They have resources available for you. And then I included some links to the Minnesota Council of Nonprofits and then to the nursing home portal and then previous rounds of PIPs. So I know that there are other nursing homes that have done wellness programs, maybe not exactly like ours, but something similar. And then just in general, I wanted to say that really the investment can be minimal. Really what you're talking about is your staff training time, and that is an investment in, the care of your residents and also the self-care of your staff.
Then the next section was contributed to by Fairview, Sandy McGurran. She's the Integrative Healing Therapy Coordinator for Fairview Home Care and Hospice, so we had her perspective, as well as Terry Werner, who is the Fairview System Director of Integrative Therapies. And they were able to supply, they provided links to resources for training options and courses, and a lot of these are free, and you can go just follow the link and it'll take you through your self-directed courses. They also provided, put together this table that outlines when to use the various integrative therapies for anxiety, nausea, pain, and sleep. And although this toolkit was intended for the anxiety, a lot of these cross over into other areas. And so, Kendra, did you want to
I'll touch base on that? So looking at the far left column for anxiety, there's a lot of modalities here. So aromatherapy being using, obviously, essential oils. Again, lavender, mandarin, and ginger are the preferred for anxiety. Breath work, so deep breathing exercises. You can pair that with aromatherapy as well. And breathing, there's a lot of research to show about slow, deep breathing and how that can train the brain to relax. Then energy therapy, and what that's referring to is things like Reiki or healing touch. We see both Reiki and healing touch in our hospital systems quite a bit now. It's pretty popular, and I'm seeing it more and more in long-term care as well. And energy therapy with Reiki or healing touch, it involves a light touch over the body. It can be 5 minutes. It can be 45 minutes, depending on the time and what the practitioner is trained in. And basically, it's the relaxation modality. We know that for sure, that people, when they receive energy work, they relax. A gratitude practice, so that's pretty self-explanatory. Practicing just saying one thing you're thankful for a day, or 3 things before you go to sleep or the first thing in the morning. Herbal tea, common ones for anxiety would be like chamomile or even lavender tea or ginger tea. Using lotion or massage, meditation, movement as directed, so things like yoga, tai chi, walking, even if the individual is able to. One of my favorite ones to do is the rocking from side to side, so they can just very gently shift their weight from side to side. That is good for anxiety and calming. That has that centering component. Music is a powerful tool for emotional health, particularly for anxiety. Nature, there's a lot of research about spending time in nature as a way to reduce anxiety, and there's been studies even with individuals who don't go outside but have access to a window that shows them the outdoors, and they have some green view. It reduces anxiety, talking about even on a physiological level, so reducing salivary cortisol was a study that I read. Prayer, support groups, so similar to the support group that I was talking about, that it was a support group, but also that psychoeducation component, so learning new skills as well as being in community. And then, again, therapy or health coaching. And like Peg said, all of the modalities are helpful for anxiety or nausea or pain or sleep. It doesn't, you don't have to follow what falls into that category, and that's the really beautiful thing about integrative therapies is that you take what works for you. And if I'm looking at nausea, and if, let's say, I don't know, peppermint or peppermint tea is what helps you feel less anxious, and that's what helps you feel less anxious. It doesn't have to fit into that box. It has to fit into your life or your client's life or patient's life.
So we have another section on general resources, and it's recommended that staff should be introduced to these courses if they're going to be providing any of the therapies. So again, here are some more links to some training modules that they can take, and they are free, so it's a great resource for the staff to go through. And then there is also links to essential oil resources, and they explain how to obtain them. You can work in negotiating discounts for them if possible. Fairview does carry these on all of their pharmacies, and on Wednesdays they do supply these, provide these at a discounted rate, various inhalers and oils at all of the pharmacies. And then we also have a section on success stories, and we feature in our toolkit one on Woodbury Senior Community. Rachel Trelstead Porter provided this story about their community, and she's the Director of Integrative Health and Wellness there. And this story was actually published, and then we were able to obtain permission to post it on the toolkit by Mary Jo Kreitzer, and she's the founder of the University of Minnesota Center for Spirituality and Healing. And as you heard from Nicole and Kendra, they also have a success story, so I don't know if you wanted to add more here, but we featured the one from Woodbury Senior Living because it was actually a published story. So did you want to talk a little bit more about?
You wanted to talk about the...
Yes. So one of our success stories, particular to anxiety, we had a resident who came to us, and this person was a little bit younger than our typical transitional care resident, and this person had been pretty active in their life, led a full life, had hobbies, did things with their partner, etc., and they had a health crisis in which they landed in the hospital for several weeks, and this health crisis greatly affected their mobility, had spinal precautions, and when they came to us, could not even leave their bed with the spinal precautions, and so there was lots of limitations to how this person was existing in their life compared to before. This person came to us on lots of medication, specifically a lot of anti-anxiety medication, and this person received the full treatment. So they had chaplaincy visits, TR visits, volunteer visits for people to chat, but this person really enjoyed hand massage, aromatherapy, and Reiki, and so part of my schedule is I saw them 2 days a week to provide integrative therapies, and it always included a Reiki session, and sometimes there was a hand massage involved, or maybe just aromatherapy, but we did this over the course of several weeks while they were in our facility, and by the time this person had discharged, they had greatly reduced the amount of anti-anxiety medication that they were taking, which I thought was pretty remarkable given the critical nature of their diagnosis and the huge, huge change in their day-to-day life and what their life looked like and what it was going to look like going home. We talk about that situational anxiety with transition, and this person was ticking all of those boxes and was so anxious. And by the time they left, they were quite peaceful. I obviously still had things to work through and transition, but I count that as a success, being able to reduce the anti-anxiety medication and improve their quality of life.
And one of the success stories that this is Nicole, am really pleased about is just the self-care application for our staff. Teaching them techniques that they can have in their life to improve their overall well-being is just so exciting and rewarding, and I see it every day throughout our facility, where they're taking their wellness into their own hands with aromatherapy or breath work or something else that they can use themselves in their own life. It's a stressful position or stressful profession, and I think that we need to remember that getting our staff tools for self-care can also help them be better caregivers in the end and have a better life in general.
And so that brings us to the tips that were also provided by Rachel from the Woodbury Senior Living Campus. But what Nicole just mentioned is one of the tips that she has. This is just a screenshot. There's only 4 bullet points of many, but start with self-care for the staff using the therapies by teaching them. And if they believe in it, they're going to want to promote them as well to the residents. And then the toolkit ends with an outcomes section. We had a different DNP student that Kendra was referring to earlier that helped with their project, help us with the outcomes, and she did some research, so we included those in the section in our toolkit as well. And Trinette McLean-Wessa was the DNP student. So finally, we are in the marketing process of this toolkit, and we're going to be approaching various agencies to help promote the toolkit in their newsletters and links to the actual website, but we also ask that you please share this information with your colleagues. And I believe now we are going to go live into the toolkit so you can actually see it, but this is housed in the Stratus and under the Quinn, and this is, when you open it up, this is just the first page, and it's, again, we took the screenshots, but as we just flip through the different pages, you'll see how much more extensive it is, and with the various links to all of the, here's the GAD-7 rating that Kendra was talking about, all of the various links to the funding ideas, all the modalities, and then we have the general resources and courses for the staff, as well as essential oil resources. And this is the success story and the tips. And then the outcomes section, a few pages long. So now we'll open it up for questions.
For questions, you can either text or if you'd like to call in, Jenna, I'll just have you explain how to do that, please.
Yeah, to ask a question over the phone above the chat box, on the right-hand side, there's a little megaphone button, and if you click that, there should be a raise hand option if you'd like to enter the phone chat.
So while we are waiting for questions from the audience, I have a few. This is Janelle. So one is, it goes to the Good Sam people. How did you first identify that anxiety was something you wanted to or needed to address? Is there anything that triggered it, or?
We did a deep data dive looking at all of our hospital readmissions, and you can often spend a lot of time looking at primary diagnosis and the primary reason someone was admitted, but underlying that, when you looked at the symptoms prior to admission, anxiety played a big role. Either it was well-defined and actually noted, or it was a story that was told in the progress notes. So there had to be a lot of, anecdotally we kind of knew that it was there, but there was a deep data dive that was done to look at it as well.
And then how did you teach, talk a little bit about your staff education. So how did you teach your staff to recognize the symptoms of anxiety? Was that through like in-person classes or one-on-one or?
So when we implemented our pathway, the DMP students that I worked with, Michelle Anderson, put together basically a YouTube sort of presentation going through a PowerPoint, and so giving some background about why we were doing it, and then explaining the different steps, how to use the tool. If they were going to be doing the screening, I ended up doing most of the screening, but most, like to your point, most of the training was about how do you identify anxiety, and most of the staff is really quite keen to picking up on those sort of things, so it wasn't a huge logical leap for them. It was something that they were doing already. We were just asking them to implement a different or more structured intervention than maybe they had in the past. And so it was pretty easy, and then we just assigned it via email, and I rounded on the people who worked in that TC unit and said, have you watched the video?
And what was their response? Were people pretty open and excited to be offering?
Yes, because, and I would say it was easy because they were already utilizing the integrative therapy tools. I had trained all the staff already on how to use it and what to use, what to expect. We've got binders all over the place that show all the steps of what to do for every different type of modality. So there was a lot of education way before that. So they were already using the tools, but they weren't using it in a structured, intentional sort of way that you can collect data and measure out of. And so giving them a framework specific, because at that point it had just been when you identify these things or your resident says they have these symptoms, then these are your tools to use. But this was a more structured approach.
Thank you.
Yeah.
And I'd like to add in the Fairview Home Care and Hospice setting, so once they leave the TCU, Sandy McGurran, who I referenced earlier, she trains every single new clinician that is hired in Fairview on all of the therapies.
Goes with the next question.
Yeah.
Rather well.
Oh, okay. And so she has even starter kits for every clinician that they bring with them, and she trains them all, and then provides them if they need a refill on anything. I've made home visits. Fairview Partners also provides on-site or care coordination for dual-eligible seniors, and I have made home visits with some of our care coordinators and have seen them using some of those kits. So it works really great in the home care setting as well.
Yeah, so to answer that question, specific suggestions?
Read the question.
Okay.
So somebody asked a question. I work for a skilled home care agency. Any specific suggestions for implementing this in home health? Well, I would suggest the starter kits for your clinicians and having them go through the training that is in the actual link, and then it will give suggestions on how to obtain the products for future use, and then just continuing to have that available to them. Also, the Fairview Partners program, as I mentioned, we provide care coordination for the dual-eligible seniors, and when our care coordinators notice that we have somebody going to the ED, 8 times in 2 months and identifying it from anxiety, we also have kits that the care coordinators can bring into the home to offer the members as well. So it's nice to be able to, I think, have starter kits for people and then be able to provide it moving forward, and possibly through the funding ideas, using those grants and whatever to obtain that.
So what specifically is included in the starter kit?
For home care and hospice, there's a calming and a soothing. It's like an oil.
Essential oil.
Yes, and then there's like little cups and cotton balls.
Okay.
So the clinicians are taught to do the inhaling of it, and not actually put the oils on the clients. For Fairview Partners, we have adult coloring books and then inhalers that the Fairview Pharmacy actually sells. They almost look like a little tube of chapstick. And you have some similar that you've made yourself, or?
Yeah. So you can make the aromatherapy sticks, that they do look like chapstick, and you sort of can cap them, and they last usually about 3 months. So you can uncap them and then inhale, breathe in, and then recap it. And as long as it's capped tightly and kept out of, the sun or heat, they can last for about 3 months at least, which are really nice. And anything else, and you can put in the toolkit like a breath work card. So cues that you would say to help someone through a deep breathing exercise. So you don't have to have it memorized. Or other things you could put in the toolkit would be like a script for a body scan or a guided meditation. And so whenever I have tools set up, I always like to think about how can I make it easiest for the staff person to use it. And so if I don't want them to have to memorize a script or have to memorize breath counting ratios or the cues to say to help someone relax. You can even put it on a little laminated card in a kit so it's at their fingertips. That I think is most beneficial in getting people to use the tools, and also it's not expensive. Like, you don't need to have tons of money to build a toolkit. Really, the oil is probably the most expensive, and even so, it's not as expensive, I think, as you might think.
And we also reference in the toolkit, there's even some apps for your phone that you can just download and about breathing. And
yeah, the Calm app is a great app for guided meditation and breath cueing, and it's great for building up breath support, which can be difficult for clients who have been sick for a long time or bedridden, et cetera. Even healthy individuals, breath support isn't something that we necessarily think about or engage with on a regular basis. So being able just to even practice that.
Okay, Jenna, has anybody raised their hand?
No questions.
Okay. I'd like you all to just touch a little bit more on staff self-care. So what does that look like? I know people can use it at home, but do you see people using some of the techniques at work even?
So in our facility, and I think Kendra can probably speak to this as well, I see a lot of aromatherapy going on, which is really exciting. You see people that you wouldn't think maybe would gravitate towards aromatherapy with cotton balls and tape on them, and they're either seeking it out or giving it to themselves. And I see that kind of staff are helping each other with, they see somebody who is stressed and it's a suggestion that they make. You're experiencing anxiety or stress, why don't you think about some lavender right now? Oh, you have some pain, maybe you should think about some ginger. But just thinking about health in a different way. And really all of that has come from Kendra teaching them about what we do for our residents, but that it has applications for themselves. So I don't know, you can...
Yeah. I'm very passionate about that because the program is successful when people can engage with themselves. They can feel it for themselves. They see this works, or this works for them. Maybe it'll work for the resident that they're caring for. And I see it in they'll practice acupressure points on themselves, or they'll tell me a story about how they did it with their kids, and so they're going to, use it with this resident or that resident that they work with. Or I also see it when staff will say, go see Kendra. If if someone has a headache or they're feeling nauseous or they're tired and they're halfway through their shift, then they'll come and seek out, and maybe we'll do a quick meditation or a little Reiki or some acupressure, or even handing out the essential oils. And so I think that's really cool when people are ready to engage in that for themselves and their families. And then another thing that we do is just giving people permission, I think, is a huge part of it, saying it's good to take care of yourself while you're at work, and that helps you be, your best self, a best employee. And part of that is a mindfulness training that we do as well. And so when people are hired, we do, it takes 10 minutes to talk about mindfulness, and then encouraging people to find a mindfulness cue at work to help them stay present. And when you can stay present, everything seems less overwhelming.
I think it's really built in different culture. We already had a great culture. I think it's really built a wellness culture in our facility and something that I'm really proud of, and I feel when you walk through our building that it's really real for our staff, and they're making it real for our residents.
Okay, Jenna, we have another question. I'll have you read that, please.
Yeah, is anyone tracking how effective aromatherapy is for residents using the products?
Yes. Let's see here. Did I bring my... Actually, aromatherapy was probably close second tie for the deep, calm breath work, but aromatherapy was actually our most effective for anxiety. We have tracked for anxiety with 74% of individuals out of, or excuse me, 74% of instances out of 480 total responses that their symptoms improved. So, and that was based on staff observation. So when they implement or provide the aromatherapy, then they would click a button saying, stay the same, got worse, got better, no change. And so aromatherapy has been the most effective, and I would say also that's, like Nicole's point, that's probably the most requested modality in our facility. And so, I mean, we go through the oils, which is really cool to hear nurses asking for. And when I get to work in the morning, I got voicemail saying we ran out, we need a restock. And so it lets me know that they're using it for themselves, and they're also using it for their residents. They see how it's valuable, and we have some data to back it up.
Great. It's great that you're collecting data each time.
Yeah.
So you can prove that it works. Okay, let's see, do we have any other questions?
I just wanted to add something from a Fairview Hospital perspective. We're working really hard on having the information follow the patient to the TCU setting. So if something works really well for them, how will they know in the TCU that this did work? So that's an initiative that is happening right now.
Yeah.
The electronic health records and noting this, so they carry this forward.
And that's, the whole point of this coordination of care initiative is that as people move across the continuum, you're providing good care. So do they communicate that through the EMR or
right.
how? Okay, so great. Okay, so it looks like we have no further questions. And Jenna, if you want to just flip through the last couple of slides, you can see that there are a lot of references, and Kendra submitted only a part of from the lit review that they've done, so you know that it's evidence-based and backed up. Okay, so thank you everybody for participating today, and especially thank you to you three speakers and the rest of the work group who may be on the call. We really appreciate the work you've done to put this great pathway together. Before you log out today, please complete the survey that will pop up, it'll pop up. It's also in the chat as well. And once you complete it, and it won't take very long, just a couple of minutes, then the certificate of participation will pop up that you can print out and use. The session was recorded, and it will be available on the lsqin.org website in about 2 weeks. I want to thank everybody for participating today, and I hope you download the toolkit and you use it with the people that you take care of. Thanks so much.